Hello, hello. Welcome to Warriors Talk with author and founder Lady ReShell, where we move away from awareness towards action. This is a special edition of Warriors Talk where we're giving you 31 facts in 31 days in recognition of Breast Cancer Awareness Month. I want to highlight my sponsor, who is Pastor Michael Richardson with the Emmanuel Church of God in Christ, who has a special message for us.
Greetings, I am Pastor Michael Richardson.
And I am First Lady Anastasia Richardson from the Emmanuel Church of God in Christ. We're located at 3058 West Van Buren in Chicago, Illinois. We are building upon a solid foundation.
And we're inviting you to join us every Sunday morning on Facebook Live at Emmanuel Kojic at 10:15 Central Standard Time. And you can also view our videos on our YouTube channel at Emmanuel Kojic-MR. Once again, this is Pastor Michael Richardson
and First Lady Anastasia Richardson, and we are from the Emmanuel Church of God in Christ. We are building upon a solid foundation.
I would like to invite you to our 6th annual Survivors Night of Reflection Gala that's taking place on October the 22nd, 12 p.m. to 4 p.m. It will be at the Crystal Sky Banquet Hall at 7941 West 47th Street in McCook, Illinois. We are going to be celebrating all cancer survivors on that day. Their admission is free, but if you are not a cancer survivor, then the cost would be $40. Survivors, you must register so that I can get a accurate head count of who all will be celebrating with us. We're going to nominate a Survivor of the Year, a Community Service Award of the Year for a survivor that's out there in the community sharing and spreading information about breast cancer. And then this year I added the Caregivers Award because for some reason we tend to forget about those who are taking care of the individuals with cancer. We're going to financially award a recipient who is in battle and actively fighting. So you want to join us on that night. Our theme for the night is a season to emerge. We have sponsorship opportunities available, vendor opportunities available. You just need to go to Eventbrite and type in Survivors Night of Reflection Gala. Come out and enjoy the afternoon with us as we celebrate survivors on that day. Co-hosting with me today is 13-year breast cancer survivor and advocate, Angela Gilliam. Hey, Angela.
Hello, Lady ReShell.
How are you
today? I'm great. I'm excited. I'm excited about this show as I was the last 3 days. So I'm excited as the day goes on and the evening, the night, the rest of the month.
This is day four of breast cancer awareness, and I'm excited about the topic. We already have Mylea here. She says, I'm ready to learn about mammograms. So much of the information out there is not accurate or not available. That is true. So we're here to give you the facts, you guys. This is not something we have made up on our own. So we're giving you the facts about everything you need to know about mammograms. So I wanted to ask a question, Angela. When was the first time you were introduced to mammograms?
First time I was in. Go ahead.
Or the first time you heard about mammograms?
The first time I heard about mammograms, my mom used to go take mammograms when I was young. I think I was a teenager. I was in my teenage years. That's when I first heard about a mammogram. My mom and my sister.
Your mom and your sister. Yeah. I think the first time I heard about mammograms is when I worked at Rush Hospital, and I just remember being in the area where they were getting the mammograms done. So that was the first time that I've heard about it. I don't remember my mom going to get mammograms. I really feel like I think she was getting her annual mammograms, but she never mentioned, I'm going to get a mammogram. But she has her routine that she does annually that she's been doing for years, and she's 78 years old. So yeah. Wow. But I think it needs to be talked about, in the family, especially if you have girls.
Yes.
And also men, because we know that men are diagnosed with breast cancer as well. So they need to be examining their pectoral areas and having it looked at if they feel that something is not normal by their, let the doctors look at it.
Definitely.
So what is a mammogram? And because this the mammogram, I feel like there's so many horror stories out here and people get afraid of
Yes.
the word mammogram, just thinking about the procedure, because they have heard so many things out here that's negative. And so they feel like, I've heard people say, oh no, I'm not getting a mammogram, I'm not touching my breast, no, they're not going to be squeezing my breast like an orange in this machine. No.
Yes.
Yeah. And I
It's
say, oh
not
my God,
safe.
I have breast cancer and you are close to me, you love me. How could you not? How could you not go get a
Right.
mammogram? I don't understand that. They
Definitely.
I don't get it. But I know some people who to this very day, that's what they do. My Leah,
Definitely.
my Leah said, does it really hurt? I've heard
Um,
that it's painful.
I don't think it doesn't hurt like that. It's just a little pressure. It's a little tightness. If they don't apply the pressure that is needed, they can't see what's there. So anytime you're trying to find kind of anything you're looking for and it needs pressure in order to get the proper picture, you're gonna have to apply pressure and it's gonna just tighten, but it doesn't hurt as to where you, oh my God, oh, I can't take it. No, it doesn't hurt like that. It really does. It's not that severe.
I would say, even if it did hurt, and if it's only going to be for about 20 minutes, you're not even on that machine that long, right? It's the whole prep time is probably like 30 minutes, right? For you to take your
Yes.
clothes off, go in the waiting room, wait for them to call your name, and then go back there and have them set you up on the machine. The whole thing is probably about 30 minutes, 30 to 20 minutes. So your breast is not under that machine that long for you to say, oh, you know what? I'd rather not get it done and just take my chances on if I get breast cancer or not. And then you go out here and get breast cancer because you was not being proactive, because you didn't want to suffer a little pain. And it's really like a discomfort versus a pain. It's something that's discomforting because your breast is not supposed to be in smashed like that and put in that position. So you're going to be uncomfortable for a little bit. But what's a little bit compared to, catching that cancer early?
What's a little bit compared to catching it early, not only catching it early, the severity of it, and also you can lose your life if it's not up early
So
and not taken care of.
be uncomfortable for the time that you have to get this mammogram, and know that you're being proactive with your breast health, with your life. If you don't want to do it for you, do it for the people that love you. If you have kids, do it for the kids so you could be around for the grandkids, for your kids. You could see some of these milestones that, they're going to have.
Yes, yes, yes. The milestones are worth it. Just being around life, period, for your children, your family, and your grandkids, like Lady ReShell, is very, that discomfort for just a few minutes versus someone grieving a lifetime or someone just having sorrow for a couple of months or so. It's more, it's the discomfort is very, very much worth it. It's very much worth it.
And I would say, baby girl, you've been through major back surgery. So a mammogram is nothing to you. Nothing. Absolutely nothing. So I know that you would be proactive with your breast health, considering everything that I've been through and everything that you have seen up close with me going through this breast cancer journey. So If you don't do it for you, do it for your future babies that's coming. Do it for you, your hubby, so you could be around and enjoy a long life with him.
Yes, definitely.
So, all right. So, what is a mammogram and why? Why do you need to have this mammogram? Why is it important? We just told you really why it was important. So a mammogram it's an x-ray. It's a picture of the breast that is used to look at early signs of breast cancer, right? So a mammogram does not prevent cancer. It doesn't prevent breast cancer, right?
No,
It just
not at all.
catches it. It catches that cancer in the earliest stages possible. It should. That's what it's meant to catch it in the early stages possible, so that you can have a better treatment outcomes, and you shouldn't have to lose your life to breast cancer.
Definitely. And the mammogram also can let the doctor know how which breast, how the cancer will confine itself, and far as staying there, being confined to the breast area, or exactly where it can, where will it spread in the body. So the mammogram does play a part. Very important. And also from the mammogram, it can tell you exactly what kind of treatment that you're going to receive, or you can receive from the mammogram, from the scan that the doctor, I mean, from the picture that the doctor sees.
My list said being proactive is important. Thank you for this info and encouragement. I'm taking notes. Thank you for taking notes, baby girl. Make sure you share this video out so that somebody else can get this valuable information. Don't keep it to yourself. Please do that. Do that.
Yes.
Do that. Do that. When should I start getting a mammogram, and how often should I get these mammograms?
Hmm. Let's see. Let's. Well, normally they say the age 40, but that depends on the breast cancer history. If someone finds a lump, they need to get a mammogram because you don't know if it's benign or not, or malignant. Also, I think they raised it to 35 now, if I'm not mistaken.
It's still 40.
It's still 40?
It's still
Hmm.
40.
Hmm. Hmm. Okay. I thought
Screen,
I,
screening starts at 40.
I know the screening starts at 40, but I know they were talking about taking it to 35. There was a big talk about it. So I guess we left it at 40. And like we said, it depends on the family history, the genetics. That's like when you said the other day on the show, it's best to get the genetic testing.
Genetic testing is important. So
Very
when,
much.
when it comes to when should you start getting the mammogram, right? The first thing you should know that there's no one size fit all answer. Start having that conversation with your doctor, especially if you know that you have a family history of breast cancer. So baby girl, I was diagnosed at 43. So 10 years, so 33, you should already, your doctor should already know. I think your doctor already knows that I have breast cancer, right? That conversation should already be had with your doctor. My mom had breast cancer, just so you know, put this in my records so that the doctor could say, okay, well, she had breast cancer at what age? So at this age, we're going to start screening you at this age. In the meantime, when you come in for your annuals, the doctor is, she's checking you, because she knows your history. And so she, put some type of plan in place so that, the both of y'all can be vigilant about your breast health. So I would say start having that conversation early with your doctor. You don't have to wait 10 years, when you're 33. That's 10 years, before I had it. I would say if you're already seeing it, you already have a doctor where you're going and you have a relationship with that doctor, start having that conversation right now to say, what can I do to be proactive about my breast health? Because my mom was diagnosed at 43. So, but according to all of these different organizations, they saying that the screening should start at 40, right? So, the American Cancer Society, the American Society of Breast Disease, the American College of Radiology, and the Society of Breast Imaging says at age 40, for a woman that has an average risk of breast cancer. So, if you have someone in your family that's had breast cancer, you're not at average risk, right? You're not at average risk. So if you are a person who has no history of breast cancer in your family, you have no issues with your breasts whatsoever, you're at an average risk. So you can start at 40 getting your mammograms. But if you have a history with issues going on with your breasts and you have people in your family that has had breast cancer, then you are at a higher risk for breast cancer. So you should be talking to your doctor to see how early you should be getting screened. Malia says, yes, I've talked to my doctor and made sure that they know my family history. Awesome. That's so important. That's so important.
Yes, the family history. You should know your try and find out your family medical history on both your mom and your dad's side. That way you'll know what to expect in your family far as the medical. It's always good to know your family medical history. That takes a lot of weight off you know, you worrying. So if you talk to your parents and ask them what's their medical history, do they know about from the grandmother and their parents, your granddad, what's their history, what's their medical history, that way you'll know exactly what to tell your physician when you go to see them, your visit, exactly what's going on or what has happened and what's the medical history of your parents and your grandparents.
Yes, make sure that when y'all are having these family reunions, that somebody maybe print up a form and people can write down what they have been dealing with. You can put it in like this box where they drop the form inside of a box so others are not really reading the form to find out what it is. They don't really even have to put their name on it if they don't want to. They can put whether they're a male or female, and if they had cancer, what type of cancer, if they had treatment, or if they have high blood pressure, diabetes, whatever. And you could fill out the form and drop it in this box, and it could be anonymous. And then one person will total everything up. They could make a chart, a family tree or whatever, and pass it around so people will know. Again, wouldn't have to put your name on it so they won't know who really is dealing with what, because people may not want you to know, but you can know if it's a male or a female and what side of the family that is on. So it's important. Family history plays a big role. It has a big impact on your cancer risk.
Yes, yes, it does.
So are mammograms safe? Because, people are thinking like, I'm going every year to get this mammogram and they're releasing radiation into my body. And this is causing the mammogram. They're smashing my breast and maybe they're smashing the tumor. And when they're smashing my breast, the cancer cells are going everywhere just from them smashing my breast in this machine. So are mammograms safe for individuals to even be having?
They are safe, but we could detect the breast cancer.
Each time you get a mammogram, you are briefly exposed to a very small amount of radiation, but the benefits of mammography outweighs any possible harm from radiation exposure. That's what they say. So are you being exposed to radiation? Yes, you are. Yes, you are. Is it enough to kill you? They're saying that it's not. They're saying that it doesn't cause cancer because it's not enough. And it's not like you're going every day to get a mammogram. You're going once a year.
Only once a year.
Yeah. So there you have it. Is it safe? It's safe enough for you to get it done at that time to find out early. Remember, mammograms do not prevent cancer. They just catch it in its earliest stages when it's most treatable, right? When it's most treatable. And it also lets the doctor know if they're, if they need to go further and detect. Remember, we mentioned a couple of days ago about dense breasts. If they need to do a diagnostic mammogram, so that mammogram is going to tell them, maybe this mammogram is not detailed enough. We can't really see. Let's do the diagnostic mammogram. So, mammograms, according to the researchers in statistics, is the most accurate method for breast cancer detection.
Mammogram is 98%.
Go ahead.
They say it's 98%, the mammogram. 98%. But density is 30%
98% what?
accurate for detecting the breast cancer. But if you're a woman with density breast, it's 30%. Sensitivity of it can drop as low as 30%.
So according to statistics, the sensitivity of mammography is about 87%. This means that mammography correctly identifies 87% of women who truly have breast cancer. The mammogram is not that accurate. It's not that accurate at 87%, but it's the best tool that we have out there right now. It's not perfect. Some women who get regular mammograms may still be diagnosed with breast cancer, and unfortunately, they may die. Yes. So it's not a perfect tool because sometimes it misses breast cancer. But 87% of the time, it's going to catch that cancer.
What about the density part of it?
The density part is you going to them catching the density part. They ain't gonna on the regular mammogram. They don't have the percentage is not that high on the regular mammogram. So that's why you have to do the
diagnostic kind. Oh, right.
Yes. The diagnostic mammogram is going to be able to see because it again the fatty tissue looks just like cancer. So on a regular mammogram, you're not gonna be able to detect it. So they send you over to get clarity for the diagnostic mammogram.
And sometimes you have to go back at least twice when you get your annual and it comes back and it shows density. You have to get the diagnostic. So it's like you're getting a mammogram. Well, it's not like, but you are getting a mammogram twice in 1 year. But you're getting a diagnostic mammogram.
Yes. So if your doctor has told you that you have dense breasts, remember I said you should not be getting a regular mammogram. You should be always getting the diagnostic mammogram. When you go back for your mammograms, they should not be doing a regular mammogram if you have dense breasts.
Definitely not.
advocate for yourself and be like, no, no, I have dense breasts. And if you can try to go to the same place that you normally go to. So they, they have your records. You don't have to start from square one all the time. They have a baseline from your first mammogram. So try to, if you can, go to the same place to get your mammogram.
Yeah.
If you can't, then try to get your records from that place. And I remember, Angela, you telling me that before you leave the doctor's office, you can ask for your records.
You can.
Yeah.
You can always ask for a copy. They can't deny you that.
And now we have the portals. So the portals now has all of the information in it, all the test results, anything that the doctor does is in that portal. So make sure you sign up for the portal, because it's gonna, all the results and all the tests and everything that the doctor does is gonna come to you in that portal. Yes. So make sure you sign up for it when you go into the doctor. When they say, hey, did you sign into the portal? You're like, no, I don't want to be bothered with the portal. Yes, you do. Yes, you do. It's going to have all of your test results, anything that the doctor do or say, because sometimes we don't hear when we sitting in that chair what the doctor say. But everything, the conversation that y'all had, the doctor is going to put it in a summary for you can look at it later.
And a lot of times our mind has a tendency to wander off, and some things we don't hear because we're focused on something else that our physician said before that. So it's best to get signed up for it. Never say I don't have time or I don't want to be bothered with that, because that's your that's your history, that's your life, and like you say, it's easier to get.
Yep. So we know that the mammograms is the most accurate tool that has been approved for the doctors to detect a mammogram. We know that there's other things out there, but it hasn't been approved to use as a single standalone detection for breast cancer, like the mammogram has. No, it says no other breast cancer screening rival is accurate than the mammogram. And we know the government is going to push this mammogram.
Definitely gonna push it. It needs to be pushed. I think that it needs to be pushed. Do you think it needs to be pushed, Lady Rochelle?
The mammograms.
Yes.
So, just learning a lot about the mammograms, I feel like it's an individual choice. I don't think that it
Okay.
should be mandated by, by the government, by your doctor. It should be an individual choice if you want to undergo a mammogram. I feel like you should get all of the information that you need about your health, about your family health. And if you decide that that's the route that you want to go, then that's the route that you go. But just thinking about a mammogram, there are a lot of false positives when it comes to a mammogram. Sometimes people think they have cancer. You leave the doctor's office and they say, oh, we saw something, come back. We need you to come back. In the meantime, you at home stressing. You go back to the doctor, they run another test, and guess what? It was nothing. So, like I said, the mammogram is not 100% accurate. Only 87%. So it should be an individual choice if you want to get the mammogram.
Well, it should. Even when we take those tests from, working in the previously working in a medical field, when we receive a letter stating that we think we saw something, or uh, you had an abnormal reading or a test, you should always go back and get to see exactly what it is, because you need to follow up with that, just to be sure, just to be safe, because sometimes it can be something there, and then again, it can't. But there's nothing wrong with following up and making an appointment to check to see if there's something there. It's better to be safe than to be sorry. And not just so much sorry, but just to stress out and just panic. Just go see, check it out.
Yeah, I agree with if they tell you, okay, we saw something. Okay, let's investigate and see what this is. And then
Right, let's
if
go further.
if you feel like, this is something's not right, you don't trust the information, then go and somewhere else and get it done. But, get it done so that you can have a peace of mind. So that you can have a peace of mind. So the mammogram does have the false positive, again, the follow-up test, and sometimes it'll show something is abnormal. It might be cancer, it may not be cancer, but at least you'll know for sure in your mind that, oh, okay, I did all the necessary steps to make sure that it wasn't.
Because there's times when we as African American women we have fibrocystic breast. So sometimes that can interfere with our mammograms. And if they think they saw something, then they send that letter out. Go check. Just follow up and see what they're saying. And like you say, if you didn't like it, go somewhere else because you're entitled to take and go somewhere else to check yourself out. You don't have to stay or go to the same place. But, it's always best to try it. If you had the same physician for so many years, there's no need of jumping from one physician to a next, but you can always go somewhere. I'm not saying don't go and get a second opinion, but you would like to stay with someone who knows your history. And like I said, you can always go somewhere and get a second opinion. But it's always great to follow up when you receive those kinds of letter of saying that you receive the letter saying, "Oh, your test, we think we saw something or it was abnormal." Please, please go back and see what are they saying? Why they're saying that it's abnormal? And if you need to do another test, do another test just to be safe. I'd rather be safe than to be down the road some years later or some months later and it turned out to be something else. Not being, just it's nothing wrong with being safe, and there's nothing wrong with getting a second opinion.
And I know we get so busy in life, everybody has so much going on. We're busy taking care of our families and working, some of us are in school, just with life. And sometimes we put our health on the back burner, right?
Yes,
But if you're not taking care of the machine that's allowing you to do all of those things, eventually that machine is going to stop. It's going to break down. You're going to have issues to where you're going to have to go get maintenance. So the purpose of us having like our annual appointment and the different milestone screening is so that they can catch things early, right? They
yes,
We don't hear prevention of breast cancer. We hear early detection because they have no cure. They have no cure. And if they have a cure, guess what? We don't have it. And that's why people are dying.
yeah.
So do the preventive screenings that they have. Find out whatever your age is and talk to your doctor, or you could look on the internet and find out what are those milestone screenings that you need to do, and schedule it around your birthday time and just cross it off your list. Okay, my birthday is coming up. I need to do my colonoscopy. I need to do my mammogram, get all those things done and just go on about your life.
I need to do a complete body check, workup from head to toe, blood work, all of the above, EKG, everything, stress test, all of the above. All that plays a very extremely important part of the machine running because If you don't take care of you, you can't take care of anyone else. Definitely, you cannot. And the body will let you know when it's tired or you're overworked.
Mhm. Yes. I had my annual today, and I swear I was in the doctor's office for an hour. And my daughter, one of my daughters was with me because she had an appointment as well. So she said out there, she was texting me like, "Ma, are you okay? Ma, what's up? What's taking you so long?" Like me and my doctor was just like having a conversation, and she was like, "Okay, what's going on? What do you need? What do you want to do?" And when I say she was giving me every test there was in the book, we was like, okay, yeah, let's get that done. Okay, let's go. Let's get that done. Yeah, I'm here. Might as well get that done. Like,
Right.
I left there seriously within an hour. Now, when I left her, then I had to go. They drew like 7 vials of blood. I was like, and then I had to pee in the cup. I was like, whoa. Like, she was like, let's just get a workup,
A
while
complete
you're here.
panel workup.
And
Yes.
when she was done, she was like, you know what? She was like, from everything that I see, you're pretty healthy. She was like, I don't have to see
Praise
you
God.
for a year. She was like, I'll see you in a year when your results come back. I'll put them in a portal. But it just made me feel good because I'm like, I try to work hard on my machine. And even to the point to where she was telling me like how to eat and get my protein. She was like, are you having any issues? I was like, yeah, I have a hard time getting protein. So she was giving me suggestions on how to get protein and everything. So, I was like, when I left, I felt good. I was like, okay, I got that off my list. Like it was an hour because we did everything. Like I,
Right.
I wanted to make sure that I'm doing everything that I'm supposed to do with this body so that I could be around for a long time for my kids, my grandkids, my great grandkids, like my mama, she's with her great grandkids. Like, and I want to be active. I want to be going to their recitals, their
Right.
games and everything. So I have to,
Exactly.
yeah,
Exactly.
I want them
Yes.
to be able to, be like calling me, be like, grandma, you coming to my game? Grandma, and I'm in my car, like, here I come back, I'm coming. Like, you got to take care of this body.
Have
You
to.
have to find out what it is that you need to do. And if you're afraid to take these tests, man, just do it anyway. Do it anyway. This
Do
was
it afraid.
this was the first time I went to the doctor to where normally when I go, I have that white coat syndrome, Angela. And I go in there and my heart just like shh. I always
Really?
pray every time I go, every single time. This time I went, for some reason, I prayed. I oiled myself with the blessed oil. I went in there. And she was like, "Oh, your pulse was good. The blood pressure was good. Did she listen to my heart, my lungs, and everything?" She's like, "Everything looked good. You sound pretty healthy." Now I was like, "Now, normally when I come in here, they'd be like, are you okay? Are you okay?" And the doctor be like, "I'm gonna let you sit for a while before we do the pulse. We'll wait, and then we'll do it again somewhere in the middle of the appointment because your heart is just going." And I was like, and
Wow.
I kid you not, this in the long, in some years, this was the first time I went to where my heart was not racing.
That's a great accomplishment.
Girl, I was like, so because every time they do it, I'd be like, "What's my pulse?" She was like, "Oh, it was 95." I was like, "It went over 100." She was like, "No." I was like, "What?" I was like, I was so shocked. I was shocked, but I was proud of myself because every single time I would go, and this is from when I was pregnant with Kayla. I
Okay.
think, and my heart would just be racing. The doctor would be like, "Okay, go sit out there, and we'll come get you in a little bit."
Oh wow, you poor
Because
thing.
yeah, so this was the first time in a long time, so I felt kind of accomplished. I was like, yes, the heart rate was not going crazy.
Doing cartwheels, right?
Yeah, yeah, like I ran a marathon. She'd be like, "What is going on? What's going on with your heart?" I was like, "It's always that's how it be beating fast like that." She was like, "But not today." I was like, "Thank you, Lord," because
No anxieties, huh?
girl, don't let them.
That felt great, didn't it?
It did. It really
That's
did.
great. That's great. And I'm the opposite. I'm like, okay, come on, let's do this. Let's get this over with. I'm like, how long I gotta sit here?
Girl. I mean,
It's like I want to get in, I want to get out. Come on, I'm tired. Really? Are you so serious?
I felt like I was taking up all the doctor's time. I was like, I'm so sorry. I feel like I'm taking up all your time. She was like, no, not at all. She was like, I mean, she was going through all the questions, everything. And I was like, do I need to get a pap smear? She was like, well, if you have a normal one with your age, you don't have to get one for 5 years. And I'm like, well, when is the last time I had one? She was like, you had one last year. I was like, okay, let's do one this year. And then if everything's okay, then we'll go for 5 years. Like, let's go there. Girl, it was, yeah, and I felt so relieved just to get
I'm so
that
proud of
appointment.
you.
Girl, girl. I was like, yeah. So
Woohoo!
so I just I
Major accomplishment.
it was. It for me it was, especially with the
Right,
heart rate.
right,
I
right. Because that's not good. You're
no.
panicking. You next thing you know, someone is picking you up off the floor. Like, okay, are you okay?
I remember when I would have to go in the bathroom before I had my appointment, before they called me back, I would go in the bathroom and I would kneel down on the floor to just try to calm myself down before I went into the doctor's office.
Oh,
Not
wow.
today, girl. I put my big girl panties on today. I was just like, I'm ready. Let's do this. Let's do this.
Like,
Let's do this. And I think a lot of it had to do with me. I'm invested in my health. After the cancer
mhm,
diagnosis, like before the cancer diagnosis, I was a health freak, but it didn't matter. It didn't matter. Cancer
right.
still invading my body. So I'm like, right now, I'm just like, I'm invested in my health right now. So whatever I can do to where I can contribute to me being healthy, then I'm just all for it right now. And
Right.
that's including not being stressed out. So if I feel like you're gonna stress me out, I'm checking out. And I'm going the other way. Not gonna do it. Not gonna happen. Not gonna happen. So I just encourage you, if you are of the age of 40 and you have no history of breast cancer in your family, you have no issues with your breast, you do your monthly exams. And I know the monthly exams can kind of be scary because you like, oh, what if I found a lump? Oh, did I find a lump? What is that? Like, if you're doing your monthly exams every single month, if you
Mhm.
find something. Now, if your breast just normally lumpy, right? It's just normally lumpy,
Mm.
and you
Right.
know,
That's the fibrocystic breast.
so get used to how your breast feels. Now,
Yes.
if you get to a point where you feel something, get a piece of paper, draw two circles, draw where you felt it at, date it, come back to it a couple of weeks, not a month, not 2 months, not 6 months,
Give it a couple of weeks.
a couple of weeks, and then check it again and see if it's still there or if it's gotten bigger. Then you tell your doctor, hey, I was doing my exam and I noticed, and this is where it was. So the doctor could know what to do. And okay, let's just investigate, could be something, could be nothing. Most women find their own lump, or the man finds the lump.
Right. I found my own lump.
Yeah, I found my own. So if you're doing the breast exams, just do it consistently and just try to make sure you don't have the anxiety behind it. Just say to yourself, you know what? This is a part of me being invested in my health to make sure
Yes.
that, whatever's going on with my body, I'm on top of it and I know how to go be proactive and take action. So if you up the average risk to where you don't have any type of family history or you have no issues with your breast, then at the age of 40 you should be going in there getting those mammograms, right? But if you have some issues with your breast, if you've been having issues with your breast, if you have a family history to where people have breast cancer, they're dying of breast cancer, or I would just say cancer, period, in your
I was
family.
about to say any kind of
Yeah.
cancer.
Talk to your doctor and be like, hey, have that conversation. Don't be afraid to have the conversation and ask the doctor what's the plan for me as far as how early should I start getting tested or worrying about it, because the doctor also does the clinical exams. So you doing your home exams every month. When you go get your annual, the doctor does the clinical exam, and then
Mhm.
And if you have age, you do the mammogram. Now, if you are younger and you having issues with your breast and you find a lump on your breast, or you have a rash on your breast that won't go away, your nipple, you having blood from your nipple,
Yeah.
the nipple is
Nipples,
inverted,
right,
breast
inverted and
pain.
crusty. Yeah,
Yes,
pain.
yes.
Yes.
Go call your doctor and say, hey, I'm having issues with my breast. Be persistent, right?
Very,
Especially
very,
if you under 40. Be persistent and say,
very.
hey, I know that I'm under that age, but guess what? All these issues are happening and I need you to look into it. If they don't want to do it, go somewhere
Find
else.
somewhere else. Call another office.
But
Go to another physician.
don't allow a lot of time to slip by. You know, don't be like,
Stay
oh,
on
okay.
top of it.
You have to be persistent. Be your own advocate. Be your own advocate to where you say, okay, you don't want to be dealing with this. Let me go somewhere else and see. Be persistent. Open your mouth and get the doctor's attention, or go somewhere else.
Go
But
somewhere else where they're concerned with what you're feeling, and not just what you're feeling, what you're saying, and how you know what you felt and how your body's feeling. That's where you go when they take in consideration what you're saying. Here, number one, you hear what I say, what I'm saying to you. Number two, I know what I felt and I know what I'm feeling. Number three, if you can't do it, I will make an appointment to go see someone else that will take the time to hear, check me out to see if it's not just something that I think I'm feeling, that I know I'm feeling.
mhm, don't be afraid to speak up. Do
Closed
not.
mouth does not get fed.
No. And if you don't have insurance, or if your insurance won't cover it, you can always look up Equal Hope. Equal Hope, they will help you get information so that you can get a free mammogram. There's so many programs out here right now that help
Yes.
you get a free mammogram. At one point, they would have the free what was like a fire truck, or the truck that would come around, and the mammogram truck, bus, or whatever, and they will give you a free mammogram. Like, but
And
places
yes.
you have places out here that will help you get a free mammogram. So don't use the excuse, because they want to eliminate the excuse that you don't have insurance. That's not an excuse when you have organizations out here like Equal Hope that are helping women get mammograms. All right, you guys, I have to go and exercise, get my workout on so I can stay consistent with my health. So, Angela, do you have any words of wisdom about mammograms and everything they need to know?
Words of wisdom about mammograms. First of all, if you're 40, please make sure you make your appointment to receive your mammogram. Let nothing or no one or no excuse or what you hear, the foolery, keep you from getting your mammogram. Early detection save lives. And that's the key. 13 years I'm sitting here.
Okay, I will argue with you about the early detection saving lives, but I'm not going to do that right now, because people still have early detection and some of them still die. I went over that.
Right, right.
The purpose of the mammogram is that it gets you in there early enough for you to have better treatment options and better treatment outcomes. But again, some women still die.
Yes, yes.
They still die.
They
They
still die, but we still have to let them know that it can save your life if it's detected early enough. Am I right or wrong?
Say that again. I'm sorry.
I said, even though when you said that You're not going to argue with me right now about the early detection do save lives. But still, if it's detected early enough, it can still possibility save your life.
Right. It's a possibility that it could save your life. The reason why we have early detection is because we don't have a cure. So that's why they focus on early detection, is because they don't have a cure. So they can't say, oh, do this to prevent breast cancer. They can't say that. The only thing they can say
Mhm.
is early detection save lives. Early detection saves some lives.
Possibility.
It saves some lives. It don't save all lives. Finding breast cancer early may not help her live longer if she has other serious life-threatening health problems. It may not help you. May not help you. Get in there, get your mammogram done, so that if you have any issues going on with your breast, if cancer is present, the whole thing is they want to catch it in the earliest stages possible, so that you could have better treatment outcomes.
And also, ladies, learn to do your own self breast exam. Please learn how to do the proper self breast exam. Very important.
Getting regular screening mammograms lowers the risk of dying from breast cancer, but it does not completely remove this risk. So yeah, it's important to learn how to be breast self-aware by doing your own breast exams. If you find a lump, don't panic. I just said to write it down on a piece of paper, circle it. A couple of weeks, if it's still there, talk to your doctor and say, hey, this is what I found. When I found my lump, when I called my doctor, she got me in there like within the next day or so. I was in there getting a mammogram.
Yes.
So
Yes.
they're not going to be scheduling you way out no 2 months. They're going to get you in there right away. Why? Because they want to, if it is a lump, they want to get in there and say, okay, what is it? Let's get on it. Let's get on it right away. They're going to have you in there really fast. So
Very.
if you're being vigilant about checking your breasts at home, then yeah, then do that. I know that there's a lot of stress that surrounds that when you're doing it at home. It could be a lot of anxiety that comes with it when you're doing it at home, and you find stuff, especially if you're not used to the lumps and bumps in your breasts. So get used to touching your breasts, get used to your own lumps and bumps, and moving forward, if you feel something, address it. And as Donna Lynn would say, don't deny but verify.
Definitely.
All right, you guys, I am done, and that's a wrap. I hope that you have learned something today. I hope that we have encouraged you to go and get a mammogram if you are at the average risk. And if you are younger than that and you're having issues with your breast, please address them. Go and get it checked out so that you can have a peace of mind. It could be nothing. According to statistics, 87% of women, 85% of women who find their own lump, they say that it's non-cancerous. That's what statistics say.
Mhm.
So join us tomorrow for day 5 of 31 days, 31 facts in recognition of Breast Cancer Awareness Month. All right, you guys, I gotta go. I appreciate you joining us tonight. Again, this is Warriors Talk Special Edition. This is author and founder Lady ReShell with 13-year breast cancer survivor and advocate Angela Gilliam. Thank you for joining me. I appreciate it.
Thank you for having me. Good night.
All right, you guys, Warriors Talk is saving lives, and we are changing lives, one warrior at a time.